I kept hearing from these patients who had almost died and had had really dramatic experiences that had profoundly altered their lives, and yet I couldn't find anything in the psychiatric literature, the psychiatric textbooks, the medical literature that could give me any clue as to what was going on with these patients.
Mm-hmm. Why don't we, for the benefit of our viewers, just outline what a typical near-death experience would be like?
Well, a very typical pattern, or something that the patients commonly tell us, is that at this time when their heart stops beating, they have a cardiac arrest, they have no heartbeat, no detectable respiration, and very often their physicians will say something such as, "Oh my God, he's dead, we've lost him," or something to that effect. The patients will tell us that from their perspective, they feel more alive than ever. They say they float up out of their bodies and they watch the resuscitation going on from a point of view immediately below the ceiling of the operating room or the emergency room. And they say from this perspective they can see exactly what's going on down below. They can understand the remarks and the thoughts of the personnel, the medical personnel who are around. They say after a time in this very unusual experience that they're having a great deal of difficulty understanding. And in fact, how can I be up here watching me down there? It doesn't seem to make any sense to them. But after a while, they realize that although they can see clearly and understand perfectly what's going on, no one seems to be able to see or to hear them. So they undergo an experience in which they realize that this is something to do with what we call death.